being able to kind of reach out and connect with colleagues across the entire Kent, Surrey and Sussex region, many of whom I'd never kind of been able to get in contact with, I don't think, or make that network so easily without SimNet, was sort of crucial in enabling what was just a very small local project in West Kent, and has enabled it within really quite a short amount of time to become something that we're spreading out across the entirety of sort of Kent, Surrey and Sussex. So that's been really exciting. But we're on a kind of an equal footing, and we're all working together across our organisations, and that's what's been really exciting, I think, about SimNet. Definitely is those contacts that it's enabled me to have, and is still enabling me to have as well. Very enthusiastic about simulation, but I can honestly say I do feel that being involved with simulation-based education has been one of the, if not the most rewarding sort of aspects of my career so far. It's just so immensely rewarding to be able to sort of bring simulation out to primary care. Fantastic atmosphere of collaborative learning, of interprofessionals learning together and from each other, that I just feel you just cannot find or see in any other sort of way or shape or form. It's just seeing that that team in action, but also that team being able to work together to test their systems, to test their equipment, and then make absolutely sort of positive, very sort of tangible improvements as a result. And then that potential for that impact that's going to come from patient quality and improvement in patient quality and safety is just, as I say, sort of immensely rewarding. So having come from a very small sort of group of sort of 4 enthusiasts, we're up to sort of 24 enthusiasts across Kent, Surrey and Sussex. Being able to sort of see that as an interprofessional faculty as well and develop, and just some of the sort of communication that's going on between the group and the enthusiasm. So over the weekend, in fact, they were buzzing around sort of different ideas about sort of scenarios and things like that. And then there's this wonderful sort of growth of enthusiasm and ideas that they take back to their practices and again their PCNs, and it's this lovely, hopefully, ripple effect of enthusiasm that's going out, that's all centered around simulation. So sort of simulation is at its core. I would really like to see sort of increasing sort of access and equity for us in primary care to some of the simulation suites across the region. I would love to see how we go with working across our ICSs, so working with secondary care, working with community care, working with social care, and just that ability that simulation has, that which again I think no other kind of modality of education really has, to enable us to understand each other's roles, to work out how we kind of all fit within the system, and ultimately at that centre obviously is a patient, and a patient care and a patient journey, and just that ability for it to improve all of that by us understanding and working together. And look at some of the other advances in simulation, so the sort of virtual reality, the augmented reality, and really how can we look at using that again to sort of improve sort of patient care, but how can we look at that from a primary care perspective and draw on all of that lovely learning that's come from all of the work that's been done across the region in secondary care, but give it a sort of a primary care slant. I've enjoyed using Iris, and I like being able to have access of Iris. It's been really useful as to be able to feel that we've got the same system across the whole system, so that when I go on that I can see other people's scenarios, and also the way that it leads you through kind of thinking about a scenario and then linking in with INASCL and all of the kind of relevant sort of guidelines and things like that as well. So so in closing, I'd like to extend a massive thank you to Professor Dewhurst for all of his amazing work over the last few years as postgraduate dean, and I wish you all the best in your retirement.
And SimNet has provided a great opportunity for Simulation for Mental Health to present work at key stages within the project, and to receive insight and feedback from a diverse audience. It's also enabled us to keep up to date with innovation and best practice, and provided an information forum to network and collaborate with others in the field. Well, it's provided an opportunity for Simulation for Mental Health to design, deliver, and evaluate inclusive quality simulation based programs. It's provided opportunities for collaborative learning that look at multi-agency roles, practices and systems, as well as the unique lived experience of service users and carers. So simulations afforded us the opportunity to work holistically and really tailor innovative simulation programs to a multi-agency and multidisciplinary audience. I'm really excited about simulation for mental health and the next part of the journey, which includes publication, which is very exciting, and we're busy writing up now, and also more simulation based education programs for mental health, where we can really make a difference. My hope is that quality simulation is integral to mainstream healthcare education, which means creating the right climate for success by promoting a culture of safety and quality where innovation and standards work cohesively. Iris is a really useful platform. It provides a good template to author quality scenarios, and also to collaborate with others. Yeah, the foundations module was really hard work, but it was a really positive experience. And it really helped me to develop my knowledge on simulation theory and link that to practice and then put that into practice. So for me, that was absolutely fundamental for the success of my work that I have now. So I can really draw upon some of those methodologies, and it's really helped the quality of my work. So very worthwhile, very enjoyable. Yeah, really good experience. Finally, I would like to say a big thank you to Graeme for all his hard work, and to wish him a very happy retirement.
Hello, I'm Dr. Vimal Manali. I'm a consultant psychiatrist with Surrey and Borders Partnership NHS Foundation Trust. I'm also the simulation lead and locality tutor based at Guildford in Surrey. The SimNet, the network, has been really helpful in me to understand, especially what has been out there, what's been the great work that's been going on for the last several years, but also to sort of, share ideas and use as a sounding board with fellows in simulation. SimNet allowed us to realize what other providers in mental health are also doing in terms of simulation development. And some of them hadn't heard about the work that Avatar, that is our augmented virtual reality training for in mental health, we were doing in our trust, and we've been doing since 2015. So it's been a huge platform to share notes and be inspired, learning from each other. And I'm quite proud to say that our Avatar, went a couple of upgrades into digitalization of and remote delivery. So I think technology will continue to amaze us and will offer us opportunities that perhaps we don't know as of today. But I think people who have been involved in simulation have always showcased their flexibility and adaptability. So I'm sure that we are going to embrace what technology is going to offer. I should say that we are, quite happy to receive the support from Health Education England, the Technology and Enhanced Learning Simulation Network. So we are going to So we're going to evolve in our own sim delivery. So Avatar is one option, but we are trying to see whether we can move more into virtual reality. And I'm, trying to learn from other specialities, and I'm hoping that other specialities learn from mental health as well. I would also like to take this opportunity to place on record the help Professor Graeme Dewhurst, the Regional Postgraduate Dean for HE Health Education England Southeast, has provided to the Simulation Network. And I wish him the very best for his retirement and future endeavors. Thank you.
We've been able to make a package of training that is really exciting and really important, and spread the word about how we can help people with acute mental health problems. We have done it in a multidisciplinary way, which is really exciting, and we've worked with experts by lived experience in co-production, which is extremely exciting, and has given us really, really great insight into their feelings and thoughts about it all. SimNet has been really, really helpful in doing this because we've had great support from the community, and we've been able to offer our training package to anyone from the southeast region of SimNet, which has been amazing. And we've been able to really make sure that we've got a wide variety of people involved, which has been great. I've been working in simulation for a little while now, but learning all about the theories behind why we do the things we do was really, really helpful. And I felt like it really helped me develop professionally as a simulation facilitator and as a debriefer. Thank you very much, Professor Dewhurst, for all of your support throughout Simulation for Mental Health. It's been a really, really great experience, and we couldn't have done it without a really supportive postgraduate dean. So thank you very much, and hope you have a happy retirement and get lots of rest and lots of fun.
It gives me great pleasure on the occasion of Graeme's retirement to be able to explain a little bit about what we're doing in the Digital Innovation Centre that's based in Folkestone. This is an area which has got a forum, which is a meeting place that can hold up to 70 people for presentations. It has a studio which can take up to 30 people with lots of interactive screens, which also then links to our experiential spaces, our simulation spaces, which I'm really pleased to be talking to you from today. And in this experiential suite, we have Esther, who is the person on my left, who's an African descent mannequin, and lying in the bed over here is another Esther, who's also a very technological mannequin with breath sounds and heart sounds and all of the pulses, because Esther is the program that we brought over from Sweden that was basically a culture to try and say it's fine to know what is the matter with somebody, but what you've really got to ask is, and what matters to you, Esther? Because in that way, we can change the way and make it really person-centered in terms of the care that we're giving. We didn't realize that we were going to be have simulation as part of the offer that we give to people here. So when we set up this center, we really learnt from SimNet and have really tried to align what we're doing with Health Education England's priorities. And as a result of that, we've hosted a SimNet conference, a webinar. We've also done a virtual as well as physical Sim Day, mental health simulation day, which was so interesting and so exciting to be able to look at things like psychosis and depression, because we work in a very much in a collaborative way. So we have a collaborative faculty. We're not just the people that are here. We do have a full-time simulation team here. We do have a full-time technology team here. We're really keen to look at the different experiences and scenarios that people have to use their clinical and social care skills to increase those skills, increase that compassion and care so that we can really do this in a way that brings these scenarios to life. And Tim Ferriss, the National Director for Transformation from NHSEI, came and visited us recently and said we were a national exemplar for the way that we're using data in care homes, but also how we're using technology to bring that learning to life. And we were very pleased with his comments about that. We then want to create the VR and XR type of experiences, and hence we're keen to become that XR content factory that can then supplement the courses that we're delivering. But then most importantly, we want to become more mobile-y. I know that isn't probably a word, but it's a word we use. All we're keen about is how do we give that person-centered care to the person that we should be doing that. We call this Launchpad, that I've learned so much from SimNet, that simulation is so key to providing that safe environment, both for the people, the professionals who are undergoing this learning, but also for the people who they then go and deliver the service on. Macmillan come and use our centre. We do this very much on a collaborative way so that we're able to do this by bringing in other people. So we're very lucky that, as I mentioned, the mental health simulation fellows, but we've also done this with Dr. Jane Room. And I can't believe it's taken so long for us to do this, particularly in primary care. So we know exactly how to do a cardiac compressions, etc. But how does the team really work well in the scenario of somebody who's had an anaphylactic reaction in the surgery or a cardiac arrest? And Jane really helped us to bring this to life. And so that's what we mean by collaborative faculty. And we're about to do a similar course on verification of death, expected death, so that care homes won't have to keep calling out the paramedics or the GPs or other professionals just because somebody has died. They'll be able to do that verification of death. And we'll be able to do that using simulation and showing that people have got that confidence and, importantly, competence to be able to deal in that sort of scenario. So I'm really excited, as you can tell. I'm really excited about our centre. I'm really excited about our relationship with Health Education England. A lot of this has been facilitated by HEE SimNet. So thank you very much, Andy, for engaging with me and helping me to do that. And as a result of that, I really want to wish Graeme Dewhurst every best wish in his retirement. I was at the SimNet conference, so I heard you speak this last week. It was a really good conference. I learned a lot there. But I know how important you have been to medical and clinical education. And I really wish you all the best in your retirement and hope that you don't lose contact with us in SimNet and the wider faculty. So thank you very much.
Hi everybody, I'm Rosie Courtney and I'm the lead for the South East Regional Programme for Simulation-Based Education and Technology Enhanced Learning, which we affectionately call the SimTEL programme. Thank you, Graeme, for giving me the opportunity to set up this programme. It has been an absolute delight to work with you and some of the most innovative and entrepreneurial clinicians in our patch. In particular, my brilliant associate deans, Ali Bakari in KSS, Helen Hyam in Thames Valley, and Matt Williams from Wessex, and of course, Andy Buttery, who leads the KSS SimNet. And together we've built an amazing region-wide programme. I've learnt so much from the work showcased at the KSS SimNet and have expanded this with my colleagues, with both HEE colleagues and stakeholders across the region. Just this first year, we've funded every HEI in the region up to £300,000 to expand their simulation-based learning, which will increase placement capacity and in turn assist our need to increase trainee numbers. In total, we have funded almost £4 million to the South East region for SimTEL-based learning this year. In addition, on your advice, Graeme, we have started a multi-professional Sim Fellow programme across the South East. This will build a network of Sim Fellows who will bounce ideas off each other, share research such as proof of concept, and importantly, evaluation. To date, we've appointed a paramedic, a midwife, a pharmacist, and a physician associate, to name just a few. We also aim to appoint fellows who can work with the development of the endoscopy and imaging academies. We're involving primary care and social care too to make this work truly system-wide, ICS focused, and one that allows clinicians of all professions to follow the patient pathway. My vision is to really support this network and link them together so that their projects are symbiotic in nature. So together, the end product is greater than the sum of its parts. And I'm certain this will lead to an evidence-based Southeast-wide SimTel strategy, or better yet, an operational delivery plan. I do hope when we showcase this work at our next conference, Graeme, you might drop in as a special VIP and say a few words. I'm also closely linked to the national team, and I'm so proud to report that they see our work in the Southeast as pivotal. Don't mean to brag, but I quote, they've called us in the Southeast a tour de force. None of this would have been possible without you, Graeme, so I thank you for your constant wisdom and calm voice of reason. Thank you.